What do we have our eye on this episode?
Well, it's a condition which accounts for 40% of blindness in Singapore.
Wow, Mike, you're part of the 40%.
Oh, you're confusing that with hemorrhoids.
Stay with us to learn more about glaucoma on this episode of Everybody Knows.
Well, hello everyone, and welcome to season 2 of Everybody Knows. My name is Mike Kasem.
And I'm Catherine Robert. And you know, Mike and I, we may not always see eye to eye, but we do agree on one thing.
That everyone should learn more about their health. And this week, to talk about glaucoma, we have eye specialist Dr. Tan Yar Li.
Come on out, Doc.
Nice to see you again.
Great to see you too.
Hi, nice to meet you.
Okay.
Okay, glaucoma. I think it's safe to say that many of us don't really know what glaucoma is. I mean, what is glaucoma?
So if you look at this eye model over here, think about the optic nerve as the connection between the brain and the eye.
Okay.
So in glaucoma is actually a disease of the optic nerve whereby intermittent or high eye pressure can often build up within the eye and it causes pressure on the optic nerve and hence it can cause visual loss if it's untreated.
Nerve. What happens to the nerve?
Often there is a pressure build-up within the eye. So if you think about the eye drainage system as like the tap and the sink, so fluid is being produced here all the time and it flows out through the pupil and it drains out through the drainage canal over here.
Is that when I'm crying?
No, that's different. That's more like external drainage. So in glaucoma, very often it's either due to a mechanical blockage like narrow drainage angle, or in some cases it's due to increased resistance within the drainage function. And that will cause a buildup of pressure within the eye.
Okay, well, is it reversible? Who's at risk of getting it? We have so many questions, and I'm sure our guests have a lot more. So let's welcome them. She's a host and Class 95 DJ whose voice is instantly recognizable.
He's the only 968 DJ who took home the Best DJ Award at Perdana Visa 2025. Welcome to the ever-glamorous Yasminne and the charming Ravi G.
Hi, guys.
Wow, looking great, guys.
What's up, my peoples? My peoples.
Hello.
Take a seat. Welcome to the show.
Hi, Dr. Tan.
Hello.
Okay, first of all, I want to know, what do you guys know about glaucoma?
I think it means if you do get it, it's quite a silent
Killer.
killer for the eyes, and then you might go blind because it's hard to detect, right?
Yeah.
Yes.
Ravi, what about you? What do you know about glaucoma?
I think if you don't detect it early, it can get worse.
Yeah. Will you know if you have glaucoma, or is this something that just needs to be tested?
Yeah, so it really depends on what type of glaucoma. So if we are talking about primary open-angle glaucoma, it's unfortunately asymptomatic usually in the early part of the disease. So it's often called the silent thief of sight because you don't know until the really late stage. And there's another form of glaucoma called angle closure glaucoma. So in this form of glaucoma, the drainage angle is narrow, and sometimes if it closes up suddenly, it can cause acute rise in the eye pressure. So if you look at the photo over there, you can see this patient has what we call like a mid-dilated pupil because the pressure is high, and the cornea is actually hazy, and usually the eye is very red. And other than that, usually the patients have pain, headache, nausea, vomiting because of the high eye pressure. So this kind of glaucoma is symptomatic because the eye pressure usually goes up to like in the range of like 50, 60, or even higher. Normal eye pressure is usually between 10 to 21. But it also doesn't mean that if your eye pressure is normal, you don't have glaucoma, because there is this entity of glaucoma called normal tension glaucoma. So that means even if your pressure is, for example, 18, you can still have changes to suggest that you have glaucoma. Yeah, basically everybody's eyes is different. So some people, the optic nerve may be more susceptible to even like a pressure of like 18.
You know, I'm looking at the muckiness of the cornea, right?
Yeah.
What does their vision look like at this point?
Usually in acute primary angle closure, their vision would be really blurry. For example, they can't really even see numbers on the chart. So probably like count fingers or like hand movement.
But they can see faces.
Probably really blurry.
Oh, wow.
Yeah.
For the previous one that doesn't show symptoms, would you know if they came to your clinic and got checked?
You mean like open angle glaucoma?
Yeah.
Oh, yes, definitely. So
Okay.
if you do get checked, we can do eye pressure check and investigations, and those can actually help to diagnose glaucoma. Yeah, but if you don't go for your eye check, you won't know, because usually glaucoma affects the peripheral vision. So by the time it affects your central vision, usually it's in a very advanced stage.
So is this like mandatory? Would you recommend that people go every year?
Yeah, how
like,
often?
get your eye test done?
At the age of 40, definitely I'll recommend that patients go for their initial eye check. So nowadays, health screening actually includes some eye examination as well, like eye pressure check and a photograph of the back of the eye. So 40 and above, definitely. And
Every year?
so if everything is normal at the age of 40, maybe they'll recommend like another 3 years or maybe even longer. And generally, if you're more than 60, most of us will advise an annual eye check because the older you get, the higher risk that you may get glaucoma. I remember I had this patient who's only about 40. So I asked her, oh, do you have any family history of glaucoma? So she was like, no, but my parents don't go for their eye check. So I told her, you better ask your parents to go for their eye check. And when they went for their eye check, her father actually did have glaucoma.
Wow.
Yeah, so it was actually undiagnosed. That's right.
Wait. So that means he can function with glaucoma.
Yeah, that's
So
why.
he's just been living with like blurry vision.
Because I guess it's a slow progression, right?
Yes, correct. Because only when it starts to affect your central vision, then you may feel like, your vision is blurry.
So it's kind of like when you do photo editing, vignette.
Oh, is it like the peripheral?
Like it's a bit black on the
blurriness?
side.
I do have some photos showing how glaucoma patients may perceive their world. So in the first picture, you can see a patient with normal vision. Basically, you can see like everything in your field of vision. The second picture on the top right shows a patient with early stage glaucoma. You can see like what Yasminne said, like a vignette at the side. And then you can see advanced and then extreme glaucoma, whereby the field of vision is really like a tunnel vision.
The image of early glaucoma, right? That would already freak me out. But are you saying that, with early glaucoma, your eyes get used to it, that you don't even notice?
Yeah, because
it's
it
there?
really happens very gradually. We are talking about, if the pressure is not extremely high, we're probably talking about like years before it really starts to affect the field of vision more.
Is there an estimate of how many percentage in Singapore might get it?
For the age of 50 and above is about 3%.
Oh, very low.
okay,
Hey,
So when you reach 70, it goes up to as high as 10%, which is like 1 in 10.
Okay.
Yeah, which is
Low
pretty
crime
high.
doesn't mean no crime.
Yes, exactly
Yeah.
right. Is 40 the age at which, you start worrying about the chance of getting glaucoma?
Yes, definitely, I would say
So
so,
40
at
lah.
40. But of course, the prevalence is not as high as if you're somebody who's like 60 or 70.
But start checking
Yes,
at
that's right.
40. Okay, well, you know what? We'll go for a short break, and when we come back, find out whether you're at risk of getting glaucoma and what the treatment options are. Don't go anywhere.
Welcome back to Everybody Knows. Now, we have had loads of info from our expert today on glaucoma.
That's right, but as we know, hearing from someone who has had the condition always hits different. This is Wee Ming's story. Let's take a look.
Hi, I'm Wee Ming. I'm 49 years old. I'm running an education center. I used to have glaucoma and cataract. I didn't know it was glaucoma at that time, but the symptoms was like when I was driving, my vision actually deteriorated over a period of time. So when I was driving at night, couldn't really see that well. Then my family asked me to go for an eye checkup. So when I went for the eye checkup at the optician, my left eye couldn't achieve the 6/6 vision. So they referred me to a specialist. Yeah, then the specialist realized that it was glaucoma and it was cataract. Oh, I went for the vision field check. They put you in they let you see this space where there will be red dots coming out of each space, and then you're supposed to click on the clicker. So then I realized that this side of my eye, this quadrant is black. So that means I couldn't see on my left eye, so I couldn't see. Then Dr. Tan also checked my eye pressure. So not so high, okay, but it's still glaucoma range already. I knew what it was because my uncle or my auntie has it. So I went for surgeries, 2 surgeries 1 week apart. So they did it on my bad eye first. And then after that, I rested for 1 week until it more or less recovered a little bit. Then I went for the other eye. So cataract is the blurring of the lens, right? Dr. Tan told me that it was like grade 4 cataract, which is like the worst case. So probably that contributed to me not being able to see the signs on the road. So he just changed my lens. That's for the cataract part. And then for glaucoma, she inserted 3 stents at the base of my eye for both eyes. So I think that helped to release the pressure of both my eyes. The doctor advised me to rest after my surgery, so and not to engage in rigorous activities. So I had to rest for like 3 weeks to a month before I can resume those activities. I can see much better, so I can see far. It's corrected for far-sighted, but now the nearsightedness, I need to wear the normal specs. That was something which I realized, yeah, everything became very bright. Then I could see, hey, what is this white color? So then I realized that my past few years is like I've been seeing a lot of bluish, yellowish, milky color without any white. I can see much clearer than before, but because the field of vision at this part of my eye here, this quadrant, is already permanently damaged. I can't really see things at this part if I cover my good eye. So, but it's okay, I can see things much clearer than before. So I can compensate using this eye to see things from a wider angle. I guess you need to check your eyes regularly to make sure that you always have 6/6 or at least a 6/9 vision. But if you cannot achieve that, I had 6/15, which cannot be compensated. So if you have this problem, you better go and see an eye doctor.
Wow, I feel like
He's got a positive attitude, though.
his
doesn't he?
parting statement, you better go and see an eye doctor, is you better go and see an eye doctor early.
Yeah, I feel like, especially when he said that when he's driving at night, he can't see as well.
So dangerous.
I felt like, oh, that is me!
Oh my gosh. Okay, so does having cataract increase your chances of getting glaucoma?
Cataract actually doesn't really directly increase the risk of anyone having glaucoma, but in certain cases whereby if your drainage angle is narrow, so imagine if your cataract gets thicker and more dense, okay, it can actually push forward and cause the already compromised narrow drainage angle to narrow further, and that may actually cause the eye pressure to go up. In another situation, sometimes the cataract can become hypermature, so again, same thing, it can swell up and it can push forward and cause the drainage angle to narrow off, and that can cause angle closure glaucoma.
He said his uncle and auntie had glaucoma, so is that why he got it?
Some research studies have shown that if you have a first-degree relative, like your parent with glaucoma, it can increase your risk of having glaucoma up to like 10 times, which is quite a lot.
What about the other risk factors, like, for instance, diabetes or high blood pressure?
Yes, so some studies have shown that if you do have chronic medical problems like diabetes, high blood pressure, high cholesterol, all this can actually increase the risk of you having glaucoma. So it's important to get those risk factors managed so as to help reduce the risk.
Kat spends a lot of time on her phone.
He's not wrong, I do. A lot of, device time.
Is that device time, does that do anything? Can that make you more susceptible to issues with the eye?
Increased screen time, I would say it will cause more things like dry eyes and eye strain, but fortunately, in a way, it doesn't put us at increased risk, because frankly speaking, nowadays, most of us are really on the screen a lot, whether at work or, doom scrolling and stuff like that.
What if I keep rubbing my eyes? Does that put me at risk?
Especially those patients who rubs vigorously with the knuckles, the pressure can actually increase up to like 20 times. Yeah.
Wait, 20 times is crazy though.
Especially, those vigorous rubbers.
Do you guys do that? Yeah, do
no,
you?
I mean, not so vigorously, but I do rub my eyes every now and then, especially when I
kinda
get
rub
up or after wearing my lens.
Okay, let's talk about treatment. What's the first line of treatment?
So it depends on the age and also the severity, but generally at onset of diagnosis, I usually offer the patients either eye drop treatment or laser treatment. So the good thing about eye drop treatment is you can easily administer it at home and it's not invasive.
The eye drop helps to relieve pressure?
Some type of eye drop actually help to reduce the production of fluid within the eye, and some other eye drops will help to increase what we call non-conventional outflow from the eye, because the main drainage is actually obstructed or blocked.
Is it possible to just go on with eye drops forever?
In a way, yes, if the patient's glaucoma is very mild and eye drops is actually helping to maintain it without any progression, potentially yes. But of course, it also depends on at what age you get diagnosed. For example, if somebody is 80 years old and they get diagnosed with glaucoma, I mean, I guess they can just use eye drop for the rest of their lifetime. But if somebody is 40, usually at some point in time, they may require further treatment like laser or surgery. Yeah.
Pros and cons of eye drops. There must be some cons of using eye drops for the rest of your life.
Yeah, so I was gonna say compliance is the problem because a lot of patients can't really keep up with the eye drops every day, especially for the elderlies. They can be forgetful, so very often they miss the eye drop. The other disadvantage of using eye drops long term is it can cause side effects.
Yeah.
So side effects can be locally, like it can cause dry eyes, and certain form of eye drop can cause darkening of the skin around the eye, droopiness of the eyelids, or sunken eye. Some eye drops can cause systemic problems as well. For example, some drops can slow the heart rate.
Really?
Yes, yes, especially in the elderly, and some of them can actually go into like heart block and stuff like that.
If eye drops don't work, then we go to eye stents.
If the pressure is not too high, we can actually try laser. So the laser that we do is called selective laser trabeculoplasty. So basically, we laser at the drainage canal to try to stimulate the outflow.
Okay.
Yeah, so generally with successful surgery, the pressure can come down by about like 20 to 30%. So some patients may be able to not put eye drops after the laser.
Is it just by which stage it's at or by each individual is different?
In glaucoma, we always talk about the target eye pressure. So a pressure of 18 may not be good for another patient. So for example, if we set a target pressure, but despite having this eye pressure, the patient is still getting worse, then we will need to up the treatment, either by adding drops, doing laser, or in cases whereby the eye pressure is uncontrolled, then we will have to move on to surgery. Because if you don't do it, the patient is going to lose their vision.
Does going diving or doing things like
Now
skydiving,
scared, right?
where there's a lot of pressure, right? I mean, does that sort of affect it in any way, like in an environment where there is high pressure?
That makes sense.
Yes, I mean, doing things that may increase the eye pressure can potentially worsen the glaucoma. For example, things like yoga with downward dog position.
Oh, yeah, there's pressure as well,
and
right?
inversion. So those are the things that I advise my glaucoma patients not to do, actually.
I want to talk about surgery. So that, I mean, we were all, when we were watching that video, stents in your eye. I mean, I'm sure we've all heard about stents, you know.
The heart.
Stents in your eye.
Yeah, so it's actually a similar concept.
So cool.
Yeah, if you
That
look
is
at
the surgery, right?
Yes,
Okay.
yes. So if you look at the photo, if you look at the penny, that is like the size of the stent. So it's really, really tiny. So in this case, we insert the stents into the drainage canal to try to bypass the blockage, because in glaucoma, the outflow is affected.
So how long do surgeries take, and what's the recovery time?
In this case, like my patient Wee Ming, he went for a cataract and stent surgery. So usually a combined surgery takes less than half an hour. Yeah.
Wow.
Yeah,
That's
and
really
we do it under sedation, so the patient is really comfortable, they don't feel any pain. So if surgery goes well, the next day generally they can see close to perfect. Yeah, of course, I mean, not considering the area that's affected by the glaucoma, because those areas cannot be reversed.
When a patient wakes up and then can see, they must be just like, doctor, this is the best thing ever. Like, so it must be like such a great feeling for you.
Yes, it's amazing actually. So it's really fulfilling.
For sure, for
I
sure.
can see clearly now.
It looks like prevention is the way to go, not her singing. After the break, we're going to be talking about that. Plus, we have a quiz for our guests. Stay with us. Welcome back to Everybody Knows, where we are talking about glaucoma, and eye specialist Dr. Tan has been answering all of our questions.
That's right. And from all that we've been hearing, one message stands out: prevention is better than cure. Now, we know as well from Dr. Tan that you're supposed to start your eye checkups at 40. Mikey, you are way over 40. Have you gone for a checkup recently?
I did, as a matter of fact, with the lovely Dr. Tan right here.
Is that video footage? I need to see proof.
There is. So here's what I got checked for. Let's take a look. I'm 52 this year, so let's be honest, we gotta check everything, and I've been doing that. Today, we're gonna check my eyes and see how they're doing, because I've never done a full checkup. So here we are at the Asia Pacific Eye Center. Let's do it.
This is where my optometrist is checking your curvature of the cornea.
Okay.
And we also do retina imaging to actually look at the back of the eye.
How was my vision when I was doing this?
Your vision was actually perfect for far. You could see well
I don't
for a
believe.
distance without glasses, but you do have some degree of presbyopia.
Yeah, I do need reading glasses. And then, so what are we looking at?
So this scan is actually looking at the optic nerve. So basically we use light waves to take scans of the back of the eye, like the retina and the nerve, to see whether there are any early changes to suggest glaucoma of the eyes.
Is this the one where you took that like bright picture and then my eyes I couldn't see for like 10
yes,
seconds?
yes, that's the one to take the back of the eye photo.
So was there something that touched my eye?
Yeah, so for the contact eye pressure check, it was actually like a tonometer tip that touched the eye, but because your eye was already numb prior to the test, so you actually didn't feel anything. So both your optic nerve overall thickness actually looks normal, and your eye pressure just now when I used the contact one to check is 14, okay? Normal eye pressure is between 10 to 21. Yeah, so yours is really well within normal limit.
Yeah.
Your cornea is normal, okay. Except it's slightly dry. Behind your iris, this is actually your crystalline lens, okay? But so far, your lens is still clear, so no signs of cataract.
Great news.
Okay? Remember to have your eye check once a year.
All right, can do. Thank you so much, doctor. Appreciate it.
Remember, everyone, to go for an eye screen. And now, to see if we've all been paying attention, we've got a bit of a quiz. Mike and I, we have no idea what the questions are, and we're going to do a guys versus gals thing. Thank goodness.
Yes.
Yazzie is... She's quite on the ball. Shall we proceed to the game arena?
The arena. Okay, let's go.
Bring it. Where's the game arena?
Ladies and gentlemen, it's finally game time. I've got my teammate.
Yeah.
And Mike's got his. And Doc, you know what? I think we're ready.
Okay, for the first question, glaucoma is a condition that damages the eye's nerve.
Ask,
okay, Yasminne.
Yes.
Optic.
Yes, well done.
I was like, retina
to the
doesn't fit in there.
Second
Question
question.
number 2, yeah.
Tonometry is a test that measures the eye's intraocular... Yasminne?
Pressure.
Very good, well done. 2 points.
Okay, question number
Third
3.
question. One of the symptoms of glaucoma is the loss of peripheral...
Side vision.
Okay, yes.
Okay, not bad, not bad.
Okay.
All right, 2-1. Okay, next question. Glaucoma is called the silent... Okay, girls,
We got it. Thief.
Yes, well done. Yes.
When were we talking about that?
Right at the beginning. That's
At the
what.
start.
That's what doctor said.
Yeah,
she
the
said.
silent thief of sight. So the
We got
girls
crushed.
team win.
Yay!
We just wanted you to have at least a point.
Good job, good job. Thank you, Dr. Tan, for answering our 1,001 questions. It's been an enlightening session.
Indeed it has, and it's been great having Yasminne Cheng and Ravi G here with us in the studio. Thank you guys so much for coming. I'm Catherine Roberts.
And I'm Mike Kasem, and we hope you've enjoyed watching
Everybody knows! Yay!